Hello, everyone. This is Dr. Marzban from Marzban Family Chiropractic Complete Injury Centers. I'm talking from Carrollton, Texas, which is very close by to Dallas. And so here we go. We are talking briefly about the maintenance, how important it is that we talk to the patients that they most probably need that type of care. And I have only one slide, and so it should be very quick presentation. And here we go. And you see that on the vertical line, we have the pain level, and it could be from 0 all the way high, and in this case 4, and it depends how you scale it. And this horizontal line is talking about the recovery time. And the low pain, um, it can be a different type of presentation, and most of the time it is the acute case or when the patient is in the maintenance. And the high pain, usually, not always, is in the chronic case, and but sometimes the patient is going to get the high pain suddenly due to moving or accident or injury. It can happen at the acute phase as well. But usually they are in the chronic case and they have a high pain. They try multiple different things to take care of the pain, and but they eventually show up in the chiropractic clinic and to get the care and see the other options that they might want to try and help them with the pain and issues that they have. What this graph is showing is that when the pain is low and hopefully is acute, there is a better recovery that we might have in the patient compared to someone who has the high pain and is in chronic case, and it might take a longer time to take care of the issue. And what it shows here is that we are always trying to get to zero pain, which is the goal. And so, if it is acute and low pain, and the patient might be getting to the zero pain in a faster phase. Whereas the patient has a chronic pain and has a more complex issue, and that is going to take a longer time. And hopefully all of those get to zero. But sometimes the issue is so old or so severe that the pain is going to get to a plateau. And when that happens, that is the time that the patient is going to be getting into the maintenance phase. And the maintenance phase is not only for people that have pain after doing the several treatments, and the treatment is not getting better as far as the helping the patient. The maintenance can happen at any level right here, and that is for preventive, and that could be preventive and also not to reoccurring the issue that the patient has. And so the maintenance, which is the later phase in this area, it is the very important point to get across with the patient that they understand that the need of the regular visitations, and it could be from once a week, once every 2 weeks, once a month, or once every few months, and it depends on the patient and the condition that the patient has. And but again, the maintenance care is not only for people that have pain, and but also for people that don't have pain, and for preventive, planning. So that is going to be very important to us to talk to the patient about that. And the expectation is very important. And so when the patient is coming, we want to be very fair and straightforward with the patient that there is a chance that the pain is not going to get to the zero level, and also the expectation is that the patient needs to know that they have to do the homework. and such as the diet, exercise, lifestyle, and so far and so on. Because when they follow the regimen and the suggestions, then they have a better chance of recovery and getting to the goal. So the goal should be very clear to patients as well as the doctor in a mutual communication that the expectation, what it is from either side. Again, maintenance is very important for everyone to reach out to their chiropractors and get the regular adjustments to maintain their health and condition and proactively to get in the routine that they don't get hurt later time. Again, thank you so much for listening. Take care. Bye bye.